Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor, and this is a video about using low-dose immunotherapy, also known as LDI, in the treatment of PANDAS and PANS. For those of you who don't know, PANDAS is an acronym for Pediatric Autoimmune Neuropsychiatric Disorder associated with Streptococcus, and PANS is an acronym for Pediatric Acute Onset Neuropsychiatric Syndrome. And basically, these conditions are found in kids, which is why they both start with a P for pediatric, and they are typically present with tics, anxiety, OCD, sort of repetitive behaviors sometimes, and sometimes those tics can manifest in a wide range of different ways. Sometimes it's more like motor tics. Sometimes it's verbal tics. Could be making different noises repetitively, potentially, and can also sometimes manifest in like ways you wouldn't necessarily think of things ticking, such as bowel-related symptoms or bladder-related symptoms, because there's muscles there as well that can potentially tick. So if you're watching this video, you probably know about or care about PANS or PANDAS because a child in your life is affected by it. And so I wanted to just quickly share some of my experience using low-dose immunotherapy in this population. I've treated patients with PANDAS and PANS with a wide range of histories. So some of those patients have been, working with other clinicians where they've been on lots of, antibiotics or other pharmaceutical antimicrobials, or they've been working with lots of natural versions of those products. And then sometimes I work with patients where they haven't worked with anybody leading up to the point of seeing me, and maybe they're working with diet, maybe they're doing methylation support, maybe they're being treated for mold illness or various different things. So treating patients at various stages along the way, I've certainly found that I've had many PANS or PANDAS cases to date where they haven't needed to use low-dose immunotherapy because antimicrobials or diet or various things like I mentioned earlier work well to address the symptoms, things go into remission, and everything's good to go. But quite a few of my patients over the course of time have really benefited from low-dose immunotherapy. And that includes some of those patients who have done everything under the sun. It's always sort of a loaded word when patients come in saying, like, I've done everything. And it's like, well, and sometimes maybe they truly have, but at least in my practice anyways, there's usually at least something that hasn't been done yet. And oftentimes that's low-dose immunotherapy because it's just not super well known. It's becoming more and more known over time. It's been around for like 15 plus years, and yet it's still anyways not super well known. In any event, in cases where the treatments for the child, like they've done everything, quote unquote, but except low-dose immunotherapy, and in many of those cases, the low-dose immunotherapy was the missing piece of the puzzle. And then I have other cases where we start with the low-dose immunotherapy because we need to keep the cost of things really low, and LDI, thankfully, is very inexpensive. Or there's children who are they can't swallow pills at a certain age, or they won't take anything that tastes at all bad at all or has any kind of a weird texture. So we really have no other options except to use the LDI. The nice thing with LDI is it's tasteless and it's just drops of the formulas in water essentially. So you can literally get it down the hatch in anybody, which is very merciful for us poor clinicians treating kids, because sometimes that's just such a gong show. So anyways, with the low-dose immunotherapy, I have seen it to be very helpful in a variety of cases at various stages. And the formulas that I've seen to be the most helpful, of course, in PANDAS, where it's associated with Streptococcus, the Strep LDI formula is the formula of choice in that case. The issue with PANS is that, it's like, well, PANDAS is caused by strep. It's like, well, or triggered by strep. So what triggers PANS? And it's like, well, name something and it could potentially trigger PANS if it's, a toxin or a microbe or whatnot. And so, but nonetheless, that cheeky comment aside, the most commonly effective LDI formulas in my experience for children with a PANS diagnosis are the formulas for Borrelia, which is of course the causal microbe of Lyme disease. Excuse me, I've been talking too much today apparently. So Borrelia, Bartonella, Babesia, Mycoplasma, and those would be the most common ones for sure. Yeast every once in a blue moon, but really mostly the ones that I mentioned previous to yeast. Every once in a while there'll be some type of like a drug residue or something like that we have in LDI form that will be helpful. But so those are the most consistently helpful ones. And really, like with LDI, like it's just such a great methodical therapy where we start with a low dose because we don't want to induce a flare, but just gradually increase the dosage until we find the dosages that are helping, and it can just be very, very helpful. So if there's interest, I'd be happy to talk about some specific sort of case examples and things like that, obviously keeping everything anonymous. And if there's any questions, just post them in the comment section below, and I hope this information is helpful.